What symptoms does a diabetic have before they get diagnosed? Is there some event that usually happens, or can this come up just on an annual physical?
Quite a few patients prior to full diagnosis of diabetes, they have symptoms of frequent urination, and usually it's not only during the daytime, it's as well as the nighttime. They have frequent thirst. They feel kind of weak, lethargy, a little bit under the weather. And we have some cases that they have weight gain or weight loss. Now, most of the times the symptoms are present months prior to diagnosis, and in a few cases we have a precipitating event that brings a diagnosis of diabetes into the surface. The patient develops a flu, he goes to the doctor, he has a blood test, he shows the sugar is high. The patient gets a heart attack, or he goes for a surgery, or he goes into the emergency room complaining of chest pain, or problems urinating, or he has a urinary tract infection. But certainly the majority of the patients, not all of them, if you look deep into the history prior to the diagnosis, they had polyuria, nocturia, blurred vision, and weight loss or weight gain.
And when it comes to blood sugar, you always remember Wilford Brimley, and you check your blood sugar and you check it often. How often should someone who might be type 2 or obviously type 1, they're checking it all the time?
Well, we suggest in a patient on a full treatment, indifferent if he's taking insulin or medications from the mouth, to check the sugars definitely before every meal and at bedtime. Now we have certain populations among diabetes that they need to check more frequent, or they need to check an hour after they eat. For example, patients that run great or normal sugars before they eat, but an hour after they eat, they have a tendency to run high sugars. If they do not check, we cannot identify the deficiency. Also, pregnant diabetic patients, it's very important for them to check the sugars after they eat as well. And they try to keep them below 200, and ideally 160 and below. So minimum 4 times a day will be the way that compliant on-call diabetic patients should check their sugars.
And what of pregnant women? Is diabetes easy to pass on to a child, or is this something that's more genetic?
Well, family history again is very important to develop diabetes. So if the mother has history of diabetes, the kid has higher risk as well because of the positive family history of having a first-degree relative with a disease. In reference to diabetic pregnant patients, we have quite a few cases that the history is well known, so they were either type 1 or type 2 diabetics prior to the pregnancy. And during pregnancy we continue the treatment. To be more specific, pregnant diabetic patients, the treatment should be insulin, PO medications are not suggested due to the risk of fetal abnormalities.
All right. Are there any other specialists that a diabetic patient would see other than an endocrinologist?
Well, diabetes is a multidisciplinary approach disease, so quite a few specialties are involved in the continuum care of the patients. For example, certainly an ophthalmologist, an eye specialist. Diabetics have a tendency to develop eye complications, so a routine screening and follow-up is suggested by an ophthalmologist. A podiatrist, a food specialist, that's another specialty that is involved. Again, we have high risk of food infections, ulcers, and or amputations among non-compliant diabetics or uncontrolled diabetics. So a podiatry will be another specialty. Also, within the spectrum of treating diabetes, a dietitian is essential to educate and teach the patient what is the right groups of food that diabetic patients should have. a diabetic educator in general, how to take the pills or how to inject the insulin is another. Obviously an internist or a primary care physician,
Sure.
who's the first physician, our specialty as well. And then as the disease develops complications, especially with the kidneys, a nephrologist and or surgeon in case that they need a surgical. So it's a multiple disciplinary approach towards the care of a diabetic patient.
Holidays are upon us. You know, Thanksgiving, and it's
Yeah.
always food, pies, cookies, cakes. Kind of hard. What so many temptations. What advice are you giving? Could you give to our listeners now and your patients as well to
Well-
manage their junk food during the holidays?
Traditionally, human societies have associated celebration with a big bout of food and or alcohol.
Yeah.
And it's very important to stress alcohol as well in our conversation.
Yes.
Because don't forget, we're talking about extra calories. And these calories, they can
Fun as they are.
They can range from, let's say, 100 calories to all the way to 350 calories per
seen
drink.
some of these new martinis that they're whipping up. I mean, with the chocolate and everything else in there.
More than 350 calories.
Yeah.
And, you know, and in one night can accumulate major numbers by having 2 or 3 drinks. So it's not only what we eat, but actually what we drink as well. Now, the advice that I give is the same advice that I will give to every diabetic throughout the year. Just make sure you do the right thing. You can have a celebration by cooking smart. Make sure you choose the type and the quality of the food that you have on the table. More attention into fibers, less attention into carbohydrates. You see, a low carbohydrate diet means low carbohydrates and not no carbohydrate diet. So carbohydrates are always essential, but in a smaller quantity. So we have a tendency to change the calories taken from carbohydrates in diabetic patients into fiber, veggies, and so forth, as well as a decent amount of protein as well. And again, leaving the food group and be compliant with the diet, I would suggest them watch out your drinking intake and check your sugars. Just continue to do what you do for the rest of the year. You can have fun and continue to be healthy to enjoy another holiday season, but not necessarily binge into the wrong types of food.
Well, I understand there's all kinds of new cookbooks and stuff out for diabetic patients to make it easier for them to, you know, enjoy everyday foods.
Well, the choice is huge out there. There are multiple suggestions and books that they're written for diabetic diets. The only thing that I can say is that the product is out there, it's up to them to reach and get it. Even if nowadays, with the internet and the information highway, a patient can simply click and Google something in reference to a diet and obtain all the information he or she wants through the internet. So the choice out there. What we need to do is go ahead and pick it up and use it.
Yeah. And is that, because we keep coming back to that, it's like trying to drum in to your patient's head that, look, you know, you can't go on very much longer in this way. You're going to wind up losing some extremities. Is it tough to get through to some of the patients?
Yeah, pretty much complications of diabetes are major. I mean, few statistics, most common cause of blindness, amputation, and renal failure needing dialysis in USA is diabetes. Diabetes is close to 170 billion, with a capital B, billion-dollar business in USA. 1/10 of the healthcare pie goes treating diabetes and its complications. So knowing all the statistics out there, it's very important for diabetic patients to realize that they deal with a serious disorder, but on the same time, if they do certain things that they need to be done, their overall outcome can be excellent. I don't know how hard it is to understand the severity of the disease. And again, what is most important, I always say to my patients that 80% of the success with diabetes is diet and exercise. It has nothing to do with me. The doctor and the medications, only 20% of the times are successful. 80% of the times is the patient's dietary environmental habits. Okay?
So it just comes down to that. A lot of people tend to blow off their medical appointments and things during the holidays and wait till afterwards. Is that a good idea to wait till after the holidays?
Well,
Or do you want to go through this time again where you're under mental stress, financial stress, and you got all this food coming at you?
Well, I think that a follow-up appointment with a physician should not be related to holidays, to be honest with you. If the appointment happened to be before the holidays, let it be. If it happened to be after, let it be as well. I don't think the dietary or environmental habits should change regardless if you have an appointment with a physician or not. Now, a doctor's visit is not always the best thing and the most pleasant thing that somebody can do.
Get out, really?
And especially, and especially around holiday time. So I understand where they're coming from. I mean, reflexively, they have a tendency to postpone their visits. They want to enjoy the good times, or quote good times, without a presence or a visit to a doctor's office. And it is what it is. Again, my advice, just keep your appointment.